skin cells, and that can lead to the scaling on the skin surface. What is the main cause of psoriasis? Psoriasis is a speed up skin production process. So typically, skin cells will grow deep in the skin, and then they will slowly rise to the surface. Eventually, they will fall off. The typical life cycle of skin cells is only 1 month. But in people with psoriasis, this production may occur only in a few days. So because of this, skin cells don't have time to fall off. This rapid overproduction will cause to the build-up of the skin cells. What is the common signs and symptoms of psoriasis? Some of the common signs and symptoms of psoriasis is including red patches on the skin, small scaly spots, cracked skin, itching, soreness, thickened nails, and swollen and stiff joints. There are 2 products that can be used to treat psoriasis. One is Dosage ointment and Dosage cream. Dosage ointment is a product that works by slowing down the growth of skin cells. It is used only to treat psoriasis with the active ingredient it has. So, what is inside the ointment? It contains 50 mg per gram, 0.005% weight overweight calcipotriol in an ointment base of diboxy sodium phosphate, edited disodium, mineral oil, petrolatum, propylene glycol, tocopherol, stearin 2, and water. While Dosage cream can help reduce the redness and itchiness on inflamed skin such as eczema, psoriasis, and dermatitis. It is a smooth white cream containing 0.1% weight overweight betamethasone 17 valerate in a water-miscible cream base. Dosage cream also contains chlorotrazole 0.1% weight overweight as a preservative. The excipients include chlorotrazole, cetamacrogol, cetosterol alcohol, white soft paraffin, liquid paraffin, sodium dihydrogen phosphate dihydrate, phosphoric acid, sodium hydroxide, and purified water. Next, what is the difference between cream and ointments and solid dosage forms? Let's look into it. A cream is a semi-solid that is non-transparent, soft, and viscous we use for external application. Creams are usually consistently spreadable. They are typically made up of more than 20% of water and volatiles and less than 50% of hydrocarbons, waxes, or polyols. Color-wise, creams are usually white to off-white in color, but they can also come in different shades such as yellow. Compared to the oil-based preparation of ointments, creams are water-based semi-solid preparations. So when focusing on their viscosity, creams are relatively thinner than ointments, which are usually thick. So this makes creams more easily to spread compared to the ointments, which are usually less spreadable on the skin. So if you have cracked or bleeding skin, then ointments will likely feel better than a cream because ointments tends to be more soothing and less irritating than creams. So this may help anyone who has psoriasis because psoriasis can make the skin dry and scaly. However, when focusing on the onset of action, creams work faster than ointments. But when it comes to the duration of action, an ointment usually remains for a longer period of time on the skin, while a cream applied to the skin stays for a shorter period. From all the information given, in my opinion, Dosage ointment is better used for psoriasis as it works to be less irritating and more soothing for dry and scaly skin.
Hi and Assalamualaikum, my name is Mariam Zulkarnain from B1, and in this video I'm going to continue with the indications, direction of use, side effects, special precautions and storage for Dosage or Dosage ointment as well as Dosage cream. Divanex ointment, also known as Dovanex ointment, contains 0.005% calcipotriol. Calcipotriol is a synthetic derivative of calcitriol, which is a form of vitamin D. Divanex ointment is used to treat psoriasis vulgaris. Directions for use are: this ointment should be applied to affected area twice daily, and since this is for topical use, it is for external use only. For adults, Divanex ointment should not exceed 100 grams per week. Side effects include pruritus, which is itching, skin irritation, and erythema. Erythema is inflammation or redness on the skin. As usual, if you are hypersensitive towards the active ingredient or other excipients in this medication, you should not use this ointment. It is not recommended to use on the face, and you should wash your hands after every use. If contact comes into the eyes, you should flush your eyes immediately with water and seek medical care. Other special precautions include to avoid direct or artificial sunlight, and for people who have disorders of calcium metabolism should avoid using this ointment. This ointment should be stored in a cool and dry place under 30 degrees Celsius, and usually you can use it up to 22 weeks. For Betnavine cream, it has betamethasone 17-valerate as the active ingredient. Betamethasone is a synthetic glucocorticoid ester which is commonly used to treat inflammatory and itching skin. I also forgot to add that for both medications, they are not sold over the counter and should only be bought with a required prescription. This cream is used to treat different types of eczemas, including atopic, infantile, and discoid eczema. Also, this cream is used to treat prurigo nodularis, psoriasis, neurodermatitis, and insect bites. After every use, you must wash your hands with soap and water. This treatment should not be used for over 7 days, and if conditions worsen or continue, you should seek medical care immediately. Directions of use are: you should apply this cream once or twice daily for up to 4 weeks. Same as the ointment, this cream is only for external use only. Side effects include pruritus, where you experience pain or a burning sensation on the skin. But don't worry, not everyone experiences this side effect. Similar to the cream, if you are hypersensitive to the active ingredient or other recipients in the medication, you should not use this cream. Do not use this cream on open wounds, blisters, or lesions. Other special precautions are listed here. And after using this cream, do not cover the area with any bandage because this increases the adverse effects. This medication should be stored in a cool and dry place and under 30 degrees Celsius. Now, if you have psoriasis and you're wondering if you should use cream or ointment, it all depends on your skin type and skin condition. If you have normal to dry skin, I recommend you use Betnavine cream because Betnavine cream is easily absorbed into the skin and the product stays on the skin and gives a nice moisturizing effect. If you have dry to extra dry skin, I would recommend using the Divanex ointment. Ointments leave an occlusive effect on the skin, so it doesn't make the skin feel dry. They also do not evaporate off of the skin easily, so this ensures maximum absorption of the product. That's all from me. Thank you.
Hi, my name is Muhammad Asfar Nizan, and I'm gonna present my dedication on treating acne. But first, what is acne? Acne is a condition where the hair follicles are blocked by oil and dead skin cells, which consist of whiteheads, blackheads, tiny red bumps, pimples, lumps filled under skin, and sometimes with pus. The factors that can cause acne to be worse, such as what types of medications you consume, hormone changes, especially among teenagers, dietary, the level of stress, and also it can be inherited. But don't worry, the solution is here, an Oxy Anti-Blackhead Gel. many ingredients in one tube to fight acne, such as it has salicylic acid and also citric acid to exfoliate the dead skin, and oil, which causes the blockage of hair follicles. As it is a gel, it's a water-based, so it has preservatives such as ethanol, and also 1,2-hexanediol to increase the shelf life of the product by preventing the microbial growth, since it contains water as the base. Applying the product, you have to wash and dry your face before apply the gel onto the area affected by blackheads. Secondly, leave the gel to dry for 3 to 5 minutes after applying the gel, and also start to massage the area gently to remove the blackheads and oil. Lastly, wash with water and recommended to use the product for 2 to 3 weeks. Next is the precautions. Do not apply this gel on the children aged 3 years old and below. Discontinue applying the product if rashes show up. Avoid eye contact with the product, and it is suggested to use sunscreen and wear long clothing, as removing ingredients in the product may cause skin to become more sensitive. Store the product in a cool and dry place without any exposure to sunlight. And also, the product is also packed in screw cap and non-transparent tube. The reason why I choose the product because it is easy to wash with water, it doesn't feel oily, it reduces the chance of contaminated as it is packed in flexible tube, it is easy to bring along anywhere, plus it has pleasant smell. That's all from me, bye bye.
Oxy-5 by mentholatum is a cream form medication that can be used to treat acne. Oxy-5 contains 5% of benzoyl peroxide, methylparaben, and propylparaben as its ingredients. Benzoyl peroxide as active ingredient works to treat and prevent acne by killing bacteria underneath the skin, as well as helping the pores shed dead skin cells and excess sebum. Benzoyl peroxide works particularly well for inflammatory acne, which is characterized by red bumps that contain pus, bacillus, papules, cells, and nodules instead of whiteheads and blackheads. Benzoyl peroxide in Oxy-5 works as to kill acne bacteria that causes pimples, helps dry up excessive oils, and helps unlock pores. How to use the Oxy-5 cream? First, you need to wash skin thoroughly and dry well. Shake well before use, and then dab on Oxy-5 into acne areas of face and neck. First, you need to apply once a day for 2 days initially, and then twice a day if there's no discomfort occurs. Precaution step that has to be taken before start using Oxy-5 is those with known sensitivity to benzoyl peroxide or especially sensitive skin should not use this medication. Second, to test for sensitivity, apply to a small affected area once a day for 2 days, follow label instructions, and continue if no discomfort occurs. Thirdly, If during treatment, irritation, redness, burning, itching, or excessive drying or peeling occur, reduce dosage or frequency of use. Discontinue if irritation is severe, and if it persists, consult a doctor. Need to be taken as note. This product should be kept away from eyes, lips, and mouth. This product need to be stored at a cool place, preferably below 30 degrees Celsius, and keep the closure tightly closed.
Hi, my name is Aina Sofia binti Muhammad Azhar. Today, I am going to share with all of you about insect bite disease. So, let me start with introduction of insect bite disease. Alright, for overview, the majority of bug bites and stings are minor and will heal in a few hours or days. Insect bites and stings happen when an insect is agitated and tries to defend itself using its natural defensive systems, or when an insect wants to feed off the person who has been bitten. Formic acid, which is injected by some insects, can induce an instant skin reaction, causing redness and swelling in the damaged area. Let me tell you something. Stings from fire ants, bees, wasps, and hornets are usually unpleasant, and they can trigger a life-threatening allergic reaction known as anaphylaxis in at-risk individuals. Some wasps also have a severe bite in addition to a sting. Do you know bites from mosquitoes and fleas are more likely to cause itching than pain? This means when you are bitten by a mosquito or flea, you will feel itchy on the bitten part instead of feeling pain. Here are the symptoms of insect bites. First, the majority of bites and stings result in pain, swelling, redness, itching, or blister. Next, a strong response, which is known as anaphylaxis, has the following symptoms: hives, wheezing, shortness of breath, unconsciousness, and even death within 30 minutes.
Hi, my name is Naim binti Jamaluddin, and today I will share with you about this cream and this gel. Firstly, I'm gonna talk about the uses of this medication. The uses of hydrocortisone cream and SOOV bite gel, or lidocaine hydrochloride. So first, I'm gonna talk about the hydrocortisone cream first. Hydrocortisone cream is used to treat the symptom of various skin conditions such as redness, swelling, itching, and discomfort. Hydrocortisone belongs to the corticosteroid class of medication. It reduces swelling, redness, and itching by activating natural substance in the skin. Then I will talk about the SOOV bite gel. SOOV bite gel is a fast-acting cooling gel that eliminates the desire to scratch your skin following an insect bite or sting. The gel contains lidocaine hydrochloride, which anesthetizes the skin and reduces the desire to scratch it. Secondly, I will explain to you about the application. How to use the hydrocortisone cream. So you have to apply a small amount of cream to the affected area of skin in the thin, even film, and gently rub it in. Next, this is the gel. So you have to apply to the affected area for 4 times a day for the SOOV bite gel. For the number 3, I will tell you about the precaution of this medication. For hydrocortisone cream, you have to For this gel, it's almost similar like the hydrocortisone cream. For the number 4, I'm gonna talk about the storage. Both cream and gel have to store under 30 degrees, store away from heat and light. The container is aluminum tube with screw caps.
Let's move to the contrast and comparison of hydrocortisone cream and SOOV bite gel to treat insect bite. A gel has a jelly-like look and is transparent. Meanwhile, a cream isn't see-through. Gels, on the other hand, vanish because they are mainly colorless. Creams, despite having a color base, are not visible once they have been rubbed into the skin. Gels, on the other hand, absorb faster through the skin than creams. Gels are usually oil-free because most of them are water-based. For cream, some creams do not have oil, while some can have an oil mixture in it. Hydrocortisone cream can be used for children under 2 years. Meanwhile, SOOV bite gel, which is lidocaine hydrochloride, cannot be used for children under 2 years. Gel absorbs into the skin faster than cream does, so hydrocortisone cream has a lower absorption rate compared to SOOV bite gel, lidocaine hydrochloride. People with eczema are not encouraged to use gel medication as gel does not provide any protection layer to moisture the skin like cream does. Creamy medications have a richer, more emollient texture than gels due to their superior composition in fat. Fats include namely butter and vegetable oils. However, they also include essential fatty acids, vitamin F, or phospholipids. Thus, creams will have a nourishing, protective, and softening effect on the skin.
Hello, Assalamualaikum. This is Shafina, isn't it? Hi Shafina, how are you?
Waalaikumsalam. Yes, Izzatul. I'm good. Thank you for asking. Why did you call?
Actually, I want a concentration from you. As I remember, you are a pharmacist at your own pharmacy, right?
Yes, I am. How can I help you, buddy?
Since 2 days ago, my skin getting dry and so itchy. I thought it was dry because of the hot weather, but it become more itchy day by day.
Okay, it sounds serious. Can I get the picture of your skin condition so it's easy for me to know what type of skin disease you have?
Okay, wait a second. I've sent it to you through the WhatsApp.
Oh, I got it now. Actually, you have experienced eczema symptom. I will suggest you with the suitable medicine that is suitable with you.
Eczema? So far I know eczema is one of the type of the skin swelling. Can I know what the causes of this skin disease so I could pretend it becoming worse?
Really, there are no specific cause for the disease, and so far, the research of this disease can be conquered that the causes of the disease are from genetic and also environment factor.
I'm relieved to hear that. So I can be free from this disease, right?
I'm sorry, but eczema is one of the long-lasting disease that you really need to be aware of your skin condition and follow the instruction very well.
So can you explain more about the eczema disease?
Eczema is actually common in babies, children, but adults can have too. Your skin may stay dry and be irritated easily, so you need to make sure your skin is moist enough.
Okay, I get it. So what type of medication that I can use to treat this eczema?
Okay, now the drugs that available in my pharmacies are hydrocortisone cream and also dexamethasone ointment.
What the difference between the both of the medication?
First, let me explain about dexamethasone ointment, which is a pharmaceutical ointment that compound with lubricating and emollient preparations that can reduce the trauma of affected area from spread to other side. It's also easily to spray on your skin and retain at the site application. This ointment also can prevent the moisture loss and keep your skin hydrated. However, it has a greasy texture on your skin.
Get it now. I thought it was just the same between ointment and cream because it is the medicine which people usually use topically. Can you explain more about it?
Okay, typically, people will get cream compared to the ointment. It is because it gives prolonged contact in their site of application than other pharmaceutical semi-solid. It also wood friendly and easy to wipe. It also has less greasy compared to the ointment. Cream type also will make the injured area dry quickly rather than ointment. Usually, patients will be advised to reapply the medication of cream 2 to 3 times a day compared to the ointment, who's usually used before bedtime.
Oh, so I can see the difference between those medication. So from what I see from your explanation just now, both medication will keep my skin moisture, relieving my itchiness and make me more comfortable. So which one will suit me better?
Okay, from your condition of skin, I think hydrocortisone are suitable medicine to treat your eczema. It also will provide more useful advantage for you. So I will give you the medicine.
Okay, I'll pick up at your pharmacy tomorrow.
It's okay. I will give you now.
Huh? But how? Oh, what? How did you do that?
I'm just practicing my basic skill. But before I forgot, for the hydrocortisone cream, you need to apply lightly at the affected area 3 times a day. You also need to store it in cool and dry place. Please make sure the medicine cannot be reached by the children as you live with your nephew, right?
Great advice. I remember your kindness and pay it when I see you.
It's okay. It's my pleasure. Thank you.